Go. Hopefully, I don't know if you received a little notification or not that I'm recording now. But okay, so everyone, just for those of you who don't know, my name is Tiffany Robb, and I'm the program manager for the Alzheimer's Disease and Related Dementias program here in the Department of Health and Welfare's Division of Public Health. Let me make sure I can get to my right slide here. Okay, and so what I'd love for you all to do is take a moment and find the chat tab and just enter in your information, which would include your county that you live or reside, your organization or relationship to Alzheimer's or dementia or brain health, and your name, of course. That just helps us. We do keep track. We love to see where everyone is who's participating in these alliance meetings, but it also provides us an opportunity to see, do we have some gaps across the state? Do we need some representation? So please go ahead and do that. Again, I'm Tiffany and I'm the program manager here. As you're entering your name and information into the chat there, I'm going to go ahead and move to the next slide for everyone. And we're not going to read this. I feel like with putting this up, I feel like it's almost like the Pledge of Allegiance. But we don't have to stand up or do anything. But I guess it's one of those things. I'm so proud of the work that the Alliance has done so far with building our strategic plan, as well as creating a vision. And this vision is here in front of you if you'd like to read it to yourself. But I really, the part that, is easy and can stick with all of us is that we take this journey together. And I think that's important for us to always revisit, simply because of the fact that this alliance is so valuable to all of the work that we do on a day-to-day basis across our state with improving Alzheimer's and dementia awareness, as well as brain health awareness. So again, if you hadn't already, please do enter your name, your organization, your connection to Alzheimer's and dementia, as well as your county. But otherwise, what I'd love to do is go ahead and provide the first update to you. As some of you may be aware, the program, so the ADRD program itself, had applied last year to BOLD funding as well as ACL funding. Fortunately, we received both of them. We received the awards, but unfortunately, we do not have legislative approval to spend those monies. So they're sitting there, and we're just waiting for that legislative approval, of which we're hoping we will receive as of July of 2024. So once we are able to start spending those monies, we can start moving on some programmatic activities that we had planned in the work plans or outlined in the work plans for both of those. For those of you who may not be familiar, the BOLD is building our largest dementia infrastructure, which really kind of helped us help fund getting the strategic plan going, as well as some of the activities that we were able to start with. One of those being Project Echo, of which we have Lindsay on the call today, who's going to give us an update. The ACL funding is going to allow us as a program to really partner with our disability community and our caregiver community and expand caregiver respite as well as education across the state. So we're super excited for those opportunities once we get those approval to spend. So I did want to let you know that we are in conversation with two community health emergency medical service units. One of them is in Boundary County and the other is in Magic Valley. And we're looking to actually do partners or pilots with them of them going out into the community, talking to individuals and those who may have or have concerns about cognitive decline. They would be conducting an AD8 screening interview tool, which is what the Commission on Aging has been using. It is an evidence-based tool that helps individuals determine should they be reaching out to aging services and supports or having conversations with their healthcare provider about potential cognitive decline. The beauty of this tool is that it doesn't require a lot of special training to use it, and it can be, those questions can be asked not just of the person who has the cognitive impairment or decline, but those questions can be asked of the family caregiver, which is really helpful. The goal of this pilot is then for them to connect those individuals with our community care program, which is housed within the Commission on Aging, and our case managers across the state who help people with memory or cognitive decline or memory concerns get resources, supports, and education, or their caregivers get those resources, supports, and education. The other thing that I want to let you know that you're most likely aware of, hopefully, is that Luann did leave the program at the end of December. So please forgive me if I owe you emails. There's been a lot going on. And so I'm kind of backlogged on emails, but the good news is we've finished our interview process, and hopefully we will have someone hired on here soon, which will be great because it'll be nice to have more hands on deck again. Um, Other great news that you all most likely are aware of, I've tried to keep you apprised of this, is Senator Wintrow, as Senator Wintrow had approached us a year ago, and we'd all been working as a group on potential legislation. That legislation was passed as a Senate bill, so it's now in a bill form. And it was just passed to move to the floor last night for the first floor presentation. What that bill is it's an emergency protective placement, because in Idaho, individuals who have a neurocognitive disorder, so dementia and Alzheimer's being two of those, well, dementias as a whole, um, they no longer, individuals who have dementia and Alzheimer's or other neurocognitive disorders no longer fall under the protections of an involuntary hold in our state. So if a person is in crisis and may be needing medical attention and law enforcement is called, law enforcement can respond, and they may sometimes put them under an involuntary hold, but that's not technically legal in our state anymore. And so we're trying to create a new tool for law enforcement and for families and people who are in medical crisis to get that individual to the hospital so that they can have a quick assessment, see if there's an underlying medical reason, such as a urinary tract infection or something that could be causing a behavior, and then getting them back home to their caregiver. The beauty of this is that we've been working very closely with the 988 Idaho Suicide and Crisis Line. So they will step up as our 24/7 crisis support for family caregivers. And then they will be providing that warm handoff and referral to the community care program, who is open then Monday through Friday to very much support the family caregivers. So we're really trying to provide a more robust service and support for people in that crisis mode so that we can help get individuals back home. There's just a very small step in all the work that we have to do across Idaho, but fingers crossed that this passes in on the floor and then moves over to the House and passes through that system as well. And then, of course, we have launched our Project Echo series for the year. And I'm not actually going to go into much detail about that because we've invited Lindsay here from Project Echo Idaho to talk more about that. The only thing that I'll just let you know is that although we don't have spending approval for our federal dollars, we did move some of our state dollars around and choose not to go with some other projects and still fund the Project Echo so that way it could stay on schedule, because we're really trying to create some sort of routine with our healthcare professionals out there. And here's a quick shot at the agenda really quick. So next up is Lindsay, and then we'll go with Jackie and we'll move along. At 2 o'clock, you'll see that Lisa Anderson was on the agenda, but she's no longer able to attend today. So she has committed that she will provide me a written legislative update that I'll then share out with everybody with the Alliance afterwards. And so with that, I'm going to go ahead and turn it over to Lindsay. So Lindsay, you just tell me when to click, all right?
Thank you, Tiffany.
Uh-huh.
Thanks for inviting me. There's many familiar faces and names, and so I feel like I'm in really good company. I'm happy to be here. So my name is Lindsay Winters Jewell. I am a program manager at ECHO Idaho, and one of the many series that we have is our Alzheimer's disease and related dementia series. So as Tiffany mentioned, this series is funded by the department's ADRD program, and so we're really grateful for those funds to support this program. We also have some other state funds that we were able to pool together with Tiffany's programs funding to ensure that this series is able to run for an entire year. So like Tiffany alluded to, we're trying to build that momentum and get the word out that this is an opportunity for the wide range of healthcare providers to receive free training. So if you can go to the next slide, I'll talk about some of the details of this program. So we do meet the 4th Tuesdays of the month, plus a couple extras. They're trying to get in a certain time frame. We needed to get a certain number of sessions in. So you can see the specific dates to the right. Our next ECHO session for this series will be on February 27th, so coming up fairly soon. We meet from noon to 1 Mountain Time, or 11 to noon. Did I say that wrong? Noon to 1 Mountain Time, 11 to noon Pacific Time. And a real important piece of the ECHO model is this case-based learning. So each of our sessions includes a case presentation provided by one of our participants, and they present that case. We allow for asking clarifying questions, and then our multidisciplinary team of subject matter experts provide recommendations for that case. In a future slide, I'll show you who's on our team. But this multidisciplinary team really, it brings that the perspectives of the various disciplines to help solve sometimes very mundane but really challenging situations or more unusual situations. Our cases really range quite a bit. Our target audience, as you can see, are the healthcare professionals and practitioners. So from our MDs, DOs, all of those PCPs, nurses, we have several behavioral health specialists that are joining. It's the range of healthcare professionals that are able to participate and learn and earn their free CEs or CMEs. So we are really aiming to provide training so that folks can provide best practice and treat and manage brain health and other dementia-related concerns. So you can see our upcoming topics. On the 27th, we have early diagnosis of dementia in women and minority populations. So this is presented by Susan Melchiori. She is a geriatrician up in Coeur d'Alene, and also one of our panelists. And then in March, we have dementias are more than Alzheimer's disease, different types of dementias. This will have a guest presenter, Nancy Eisenberg. She is from Washington's ECHO and from Swedish. So she'll be joining us as a guest. Can you go to the next slide, please? So here's our specialist panel. We have a rock star team where you can see just a wide range of specialties representing our subject matter experts from Northern Idaho, Southeast Idaho, and Southwest Idaho. So we're really proud of the diversity of and geographic representation among this panel. I think it has been really helpful in bringing participants from throughout the state to join this particular series. Next slide, please. And the last point that I really wanted to emphasize is the opportunity for all of you on the call and your colleagues to present a case. So truly that case presentation is the meat and potatoes of our ECHO sessions. And I guess sometimes maybe folks are hesitant or feel like their case maybe isn't unusual enough or isn't, there is always some value. There's value in presenting a case. We all get to learn together and hear from the various perspectives, whether it's a social worker, the geriatrician, the neurologist. We get these very different perspectives on a case, but we have to have cases to be able to facilitate these robust conversations. So I urge you to consider submitting a case or telling your colleagues about this opportunity. In that case presentation, we try to make it very simple. It's a pretty straightforward case form. Then we provide that information ahead of time to our panelists. It's presented during the session, and then all of those recommendations are written up by the ECHO team and provided to that case presenter. So if you have any more questions about what it looks like to present a case or how you do that, you can reach out to me and I can answer those questions. I think that's it, Tiffany. One more. To learn more, you can visit our website or you can email me and I'm happy to talk more about any questions you may have about this particular series. Thank you.
Thank you so much, Lindsay, for taking the time. Does anyone, we have time, so does anyone have any questions and that could be big or small and please just feel free to take yourself off of mute and ask away. It's a small enough group. And I'll go ahead and stop sharing. No questions? Easy peasy. Lindsay, you must be so good.
Hey, sorry, this is Mike. I'm curious about what is one like case study you've done already? Like what's an example of like a case you guys have discussed?
Thanks, Mike. Mike, you're one of my favorite people in the world, so it's good to run into you. So our last case is probably the one I'll just come up to talk about. Actually, there were a lot of questions about medications, and it kind of spurred off into some new potential medications. This particular patient had passed a couple of years ago, so it was an old case, but it still offered a robust conversation about the medications for that particular individual, and then also a lot of family support. So it was the individual had Parkinson's, and the family had gone to heroic measures to keep this person in the home. And so it was a discussion of how to support and honor the desires of that family to support their loved one in the home, and recognize that they had just an immense amount of stress in that situation as well. And so I think hearing from like the medication piece, we've got our pharmacist chiming in, but also our social worker talking about the stresses that that family could be under, and here are some other ideas, other social supports that in a similar situation could be considered. I think it was that particular case was an example of providing the range of recommendations depending upon the discipline of our panelists.
Great, thank you.
Mm-hmm.
Hi, Lindsay. This is Pam Ziegenfuss, and I had a question. I take care of a man that is diagnosed with dementia, and I've been kind of wondering about if there's like activities, like I don't know, certain games, certain things that I can do to maybe help with his memory. I mean, he repeats himself constantly. He might be sliding into some Alzheimer's, but I just was going to do some research and thought, since you know all this stuff, is there anything that you've heard of games or crafts, or, I mean, I've thought of, some type of scavenger hunt or something to help with memory.
Thanks, Pam. So I have to be very clear, I am not the subject matter expert. I have the good fortune of pulling together our panel of subject matter experts, including Joanne. Thank you, Joanne, for raising your hand. She is our occupational therapist who is on this panel. So Pam, questions like that are part of what individuals are able to submit as a case, talk about the kind of the whole picture of what's happening with this particular person, and then have the opportunity for our panelists to provide recommendations. So like today in this setting, it's not my role to provide recommendations, but that's a great example of here's the situation. What do you all subject matter experts think and recommend?
Okay. Yeah, and I plan to do some research. I've been trying to be really real creative and trying to figure out ways to help him with his memory. The scavenger hunt would be like, okay, we're going to go somewhere, we're going to do this, find these things, and then we're going to go back and see if he remembers it. So anyway, but yeah, I will do that. So thank you. I appreciate it.
Thanks, Pam. Joanne, did you want to chime in on that?
I mean, just briefly. So from an occupational therapy standpoint, it's finding things to occupy their time that are meaningful to them. So understanding what they've done throughout their lifetime, that you are providing the activity at the level that they're able to engage. So you don't want to do things that are going to be too cognitively challenging, but not under challenging, and engage them. And it can be anything that they did any days, in help, having them engage in a cooking activity where they're participating in it by reading the recipe or gathering the supplies. Leisure activities that they used to love to do. It could be anything from listening to music, talking about the music, playing the music, and just remembering it doesn't have to be perfect. It's just engaging in it. There are resources out there if you just look for activities for people with dementia, and attending courses where people like me educate caregivers, and many people on this forum do the same thing, Office on Aging and stuff, that can come and give you ideas as well. But it's meeting the person where they're at and offering activities at the level that they can participate to keep them engaged. And that supports the memory because they're doing the things that they still can do.
I appreciate that, Joanne. Have you ever heard of any type of games? Like I was thinking concentration, because concentration, you're constantly, it's kind of, it's working on your memory. Is there any type of research or anything you've heard of that, or is that, I understand what you're saying, more of a repetition type schedule, learning where things are located, memory. But I was wondering if there's any type of games or anything that you've heard of.
Yeah, any card games like that, but again, you don't want to challenge them too much. So I was going to chat just straight to you to give you some ideas so that we're not taking up too much time, but I'm happy to chat with you.
Okay.
Thanks,
Thank
Pam.
you.
Thanks, Joanne. And I see Stephen had his hand up. Oh, Stephen, you're muted. Or are you muted? There you go. I hear you a little bit.
Is there another Stephen? I didn't know.
Well, oh, not Millward. I'm sorry. Yeah, Barberini. No. I see your mouth moving. Can it? Okay. It looks like you're unmuted, Stephen, but it looks like for whatever reason it's not. And if worse comes to worse, do you want to throw your comment in the chat? That might help too. I'm sorry. Technology is not a friend always. Pam, thanks for that question, and Joanne, thanks for the suggestions, and yeah, being willing to chat with Pam more. I really appreciate that. All right, so we'll go ahead, and Stephen's going to throw his comment in the chat here. While he does that, I'm going to go ahead and start sharing the slide again here on my side so that you have all of that. I'm going to actually, unfortunately, I lose my chat once I start showing my slides. So we'll go with, Stephen, if you're okay, I'll go ahead and have Jackie go ahead and go through her presentation, and then we can come back to your chat. Is that helpful? I can see your response. Okay. Okay, perfect. I can see your face anyway. Thank you. All right, so I'll go ahead and turn it over to Jackie with some updates for you all.
Hi, everyone. My name is Jackie Mendy Lewis. I'm a health program specialist for the chronic disease section here, and I help support a lot of our marketing work for the ADRD program. We do have a few updates that we just wanted to make sure you all are aware of and could utilize if you would like to. We have a couple new websites. Well, one new website that's active right now, and it's the Brain Health public-facing community webpage. I did put a picture here on the left side. That is, if you go to our IDHW, Idaho Department of Health and Welfare main web page, you click on Health and Wellness. Underneath Community Health, over there, that's circled red, is Brain Health, and that is our new page for the public. And so you can see if you just scroll right over from Brain Health, you'll see the ADRD web page is underneath these diseases and conditions. That's one that we have had active for quite some time. And then this one is obviously more focused on brain health. We try to really tailor it for across the lifespan, so it's not just so focused on our ADRD specific population. And so really exciting. I really hope you all take a chance to go check that out. And I can put that link also in the chat, but you'll get this PowerPoint where you have direct links to that as well. And then I did want to make sure everybody was aware of our ADRD Alliance webpage. This we've also had active for quite some time, but it does stay up to date with our meeting minutes, our agendas, any changes that we've had to other documents, announcements. So all the announcements that Tiffany sends out also gets posted to this webpage. So say you can't find an update from Tiffany in an email, you're welcome to go to this Alliance webpage, go scroll down to announcements and find any of those announcements listed there. This also has announcements from other organizations. So if there's been something come through to Tiffany to share out to everybody, I do put those on there as well. So if you have other announcements that you'd want other folks to see, please send them Tiffany's way and she'll send them my way to get up onto that Alliance webpage. And then I did want to just make sure everybody was aware that we are in the progress of one more type of web page. It's kind of like an umbrella web page because there's really three underneath there. But it's a provider website that is specific to healthcare providers, and it kind of walks through the three levels of risk reduction for ADRD. So our primary levels are secondary and tertiary, and really excited to get that up and going. It's still in progress, but hopefully by the next time we meet, we'll have that link to share out with you all. And then let's go to the next slide, Tiffany, if you don't mind. This is the last piece of updates, and it's specific to materials. And so if you're not aware, we do have the Health Tools website, which that is the direct link right there, healthtools.dhw.idaho.gov. And this has free materials on there for you to order. It's completely free. We ship it out to you. You could order as an individual or as an organization if you want something in bulk to have for your clinic, or if you just want a gun lock because you have a gun at home and you're a caregiver and you want to make sure that's safe. You can do that via this website. And so I do have, so you'll see the two bullets here, brochures and cards. So that is where all of our ADRD and brain health and family caregiver materials live. It's underneath. If you look at that picture, I know it probably looks small for some of you, but if you go to that website, you can click on brochures or click on cards, and then it'll be that first one that pops up underneath brochures or underneath cards. I know a gun lock is not a brochure or a card, but we'll get that fixed in its correct category eventually. But you'll find anything that you can order for ADRD or for brain health or for family caregivers underneath those two pieces on that Health Tools website. And so some new things, if you haven't been on in a while, there's other materials on there like our strategic plan materials, and some other type of rat cards that are really helpful for folks. But the new things that we have on there is a gun safety and dementia card. You'll see that right here. You can find that on the website. And that pairs really well with gun locks. And so you can also order gun locks, which you'll see here on that site as well. And then we do have a new youth material, youth focused material. It's uses our new creative, that Noggin character. Noggin is the name of that brain character there. But it's a rat card for youth. Listen to Noggin, protect your brain. And then you'll see the back part of that rat card is the wearing a helmet, avoiding nicotine, getting enough sleep, and not vaping. So, and then that QR code links to the Brain Health webpage. So really helpful rat card there as well if you have youth that could benefit from this. So anyways, those are our materials updates and our website updates. Happy to answer any questions if you have any.
If anyone has questions, please feel free, take yourself off of mute. We have enough time and space for it today. Thanks, Sarah. And just in case some of you are wondering how are we affording the printing on this and stuff, that's something that with the state dollars, it's with talking to some of our community partners, this helps some of our community partners who maybe don't have the printing budgets and so on. So we've decided that some of our budget should be or remain for printing of these kinds of assets. Usually when we do print, we get not a huge load because we don't want storage lockers full. But when we do get them, then we do send out to, for instance, all of our area agencies on aging received some care packages not too long ago, and then all of our public health districts had received them. But as Jackie said, please feel free to put in orders as you would like. The gun locks, if you are an organization and you're wanting gun locks more than just the 2 that it limits you on there, please just let me know because we can make sure to, or make a comment in your order form. I think you can do that, right, Jackie? Can you do that, a comment in there? I've asked Alicia to keep note of that if it's possible.
Okay,
But,
I'm not sure if it is, but
okay,
you
okay.
might have to email directly.
Okay, perfect. And just so everyone is aware, the gun locks, we've partnered with the VA. So the VA is getting me these gun locks. So I just received another 1,000 from them. We distributed 1,000 already. And so this is the next 1,000 that we have from the VA. And so they've worked with us in partnership to get these gun locks out with this new material that we've used the Alzheimer's Association information to develop the rat card with. So, all right, if there's no questions, we'll go ahead and move to the next. Jackie, thank you so much for your update. Okay, Stephen, I'm coming back to you. So let me stop sharing screen. Did your
Can you hear me now?
yes.
Okay,
Oh,
I
perfect.
changed
Good.
my settings on the mute. It went to a default that wasn't to my speaker, or my microphone.
Fair enough. Did you want to go ahead and say what you put in the chat? I can't find my chat while I share my screen.
Yeah, Pam asked simple games to do. I'm actually a person living with dementia. I've been living with it for 11 years. So a simple one is you take a deck of cards and just put them face up, 2 cards, and then flip them over and just see if the person can remember one of the 2 cards. And once 2 cards is very simple, you can move up to 3 cards, just face them up, then face them back down and see if they can remember which card. So it's very simple, non-threatening. And then the ones they get, you move over to the ones I got, the ones you missed. And hopefully, if they're what's the word? A competitive person, they're going to want to try and make that pile higher of the ones that they remembered. Another one, people really have strong memories of feelings of things that they've been or seen. So a great one is if they have a smartphone and they're a person that takes pictures or there's pictures on their phone, is go to their phone, open up their photos. Don't go to like the last photo they just took, like 10 minutes ago or the day before. Scroll back a week or so of a photo they took or a photo they're in and open it up and show it to them and ask them, tell me about this photo. So it'll remind them. And again, for a lot of us, my trigger for my memory is photos. I must take, tons of pictures every single day. I have thousands of pictures and videos on my phone. And that's one of my memories is when I see photos, those brings back a lot of my memory. So it's a great one, especially if it's on their phone, it's something they took.
I love that idea. These are some good, Stephen, these are some good ones that I might be doing for myself.
Stephen.
Lynn has her hand up.
I'm sorry, I didn't mean to. I was going to clap. That was great suggestions. I love that.
All right. Okay, so Stephen, we're going to start tapping on you for more suggestions and stuff as we go along. Just shout out.
Thank you.
And thank you so much for being here. Thank you, thank you. Okay, so we're still showing my screen. So our next presentation was supposed to be Lisa Anderson from the Alzheimer's Association, but she unfortunately was unable to be here today. As I mentioned earlier, she will be providing me a legislative update, and so I will send that out to all of you once I have that. Keep your eyes peeled for the for an email from me with legislative updates. She said she did want to just make sure that she has federal legislation as well as our local legislation that's going on. All right. So I know that some of our groups or team leads needed to leave early, so I think this is actually going to work out really well for us. And I have a feeling we're going to finish up our alliance meeting super early today. This is the time within our strategic or within our ADRD Alliance meeting that we reserve time so that our strategic goal plans can actually report out on the activities that have been outlined within the strategic plan. Now, as a reminder, the strategic plan had 7 specific strategies or critical success factors that were outlined that had SMART goals that were attached to each one of those critical success factors. Sorry, it's a tongue twister today. And so the goal teams, individuals self-selected themselves to get into groups, and those groups have been meeting, some of them monthly, some of them every 6 weeks, depends upon the group, but have been meeting and providing updates on specific spreadsheets. And I think we've got some great momentum moving forward. The thing that I would like to just bring to your attention is on the screen right now, you do have our specific goal teams 1 through 7, and you'll see some have a lot of team members and some don't have so many at all. So if there's an interest to you in any of these, please let me know and I can introduce you to the other goal team members, and I'm sure they would welcome you with open arms. So the first goal team is really looking at that brain health and wellness, as well as how do we get early detection? How do we get that awareness to early detection out there to our community members? This group, again, has a good team that's been regularly meeting. This goal team 2 has early detection and support. So what we're really looking at for goal team 2 is when an individual receives a diagnosis, how do we maintain quality of life? What are the ways that we can get education and information out there so that people don't lose all hope, that there is still life to be lived? And really, again, encouraging the early detection portion of that, and that trying to make sure that the family or whoever the support system is starting to be established for that individual. Goal Team 3 is really focusing on the healthcare provider or healthcare professional training and education. So a part of that being with Lindsay or talking about the Project Echo today. Another goal team is Goal Team 4, and that's community training. So they're really looking at how can they make it to where we can really establish 10 dementia-friendly communities within our state by 2028, and trying to get that community education out there, that awareness again to what is dementia in our communities and how can we become most dementia-friendly, decreasing stigma. Our goal team 5 is really focusing on caregiver supports. We all know that family caregivers serve a super important role when serving individuals who have Alzheimer's or any types of dementia. And so we want to make sure that we support family caregivers along the way. So they're really looking at how we can improve that support structure. Enabling factors is where we're really looking at what are the systems in place that maybe have been obstacles and may need to be improved. Are those policies? Are those cultural competencies? How can we really get education and information out to our communities to serve all of our Idahoans who are either at risk of dementia or Alzheimer's, or are a family caregiver of, or just because they need brain health education and awareness as well. And the last goal team is our goal team 7, who's really looking at the workforce strengthening, which can be a bit of a big task if we were to think that we were doing this all on our own. But if you've been around Idaho through COVID, you know that workforce is an issue in pretty much any industry. And there's a lot of groups working on this, but how can we really improve the workforce community out there? And that does include direct care workforce as well as our unpaid workforce, which is super important to be aware of. Now, I wanted to go through and just give you a brief on each one of those for any of you who had decided, hey, I've got a little bit of time and I'd like to get involved. And so what I'd like to do now is I'd like to actually, I'm going to stop sharing my screen. And what I would like to do is turn it over to the goal teams to provide some report outs. Just a heads up, the spreadsheet that they provide updates is kept on a web page for us that we can collect information on, and that's helping us keep track of where we all are as a full state on all of these activities per each of the strategies. And so with that, I'm going to go ahead and stop sharing my screen. And I know that Melody had to leave really early. And so Melody, did you want to go ahead and do your goal team update, or did you want to turn it over to, I saw you had a message in the chat, but
Well, I had someone who might be able to do it, but they're dealing with someone with dementia in crisis.
Oh, there you go.
Exactly. So here we go. Yeah, thank you all for letting me go first. I'm leading Goal Team 3, and I think we're kind of slow on getting ourselves rolling here, but I think one of the biggest issues that we have discussed is kind of coming up with, and we hear echo, but what else is out there, right? And we're trying to identify what's out there in terms of dementia-related education for primary care clinicians. And then, where is it being offered? What platforms cost? And is there CE? Those kinds of things. So that's one thing we want to try to look into. And then we were wondering about a survey of the PCPs out there, MDs, DOs, NPs, PAs, because, well, anyway, and just to find out what they know or don't, or what they've had or they haven't had, to identify gaps. Because I think we've found that quite often if somebody's had something, or they may say, oh, I don't take care of anybody with cognitive changes. And if they take care of, in particular, older adults, I'll bet you that's not true. Anyway, they just may not recognize it. One of the companion pieces that goes with that If we wanted to develop a survey, Tiffany, we'd obviously reach out to you to find out how that would work, or, construction and analysis, that kind of thing. But then we could, report those findings, identify the gaps. Really, once we identify the gaps, and I know you had goal team 7 is workforce, and that to me is one of the vital pieces that connects to our goal, simply because, as most of you know or may know, if you take someone and they go into a clinic, it is not often the clinician that's doing the cognitive testing. It's somebody else who may have never been trained or had inadequate training to do that testing. And so it becomes imperative that the people that are doing the things that actually help people know where they are if they're on that trajectory really need. So for the clinicians, we need to know that the clinicians know the appropriate things, right? And then that the clinicians are sharing that with their staff. I've had encounters with clinicians who have said they have the authority to direct whatever they want to have their staff do, and that's fine, but they need to make sure that their staff is doing it correctly. And cognitive testing is one of the things that is done at every annual Medicare wellness visit. So it's in the system, but we don't know how well it's being done. And, it's sort of that thing with data, garbage in, garbage out. So, what do you get? So that's kind of where we're at right now. We don't know where we are statewide. And we'd like to figure that out before we can make recommendations. Obviously, recommending ECHO is a good start because they've already got the ball rolling. So that's all we've got for now. And we're trying to, we're all somewhat computer illiterate. So we're trying to figure out how to use this fancy setup that Tiffany has. We tried and it went berserk on us the other day, and we ended up like we went from Earth to Pluto in like 3 keystrokes and couldn't get back. So anyway, we're saving stuff on just a good old plain Word document till we can figure out how to make that thing work for us.
Melody, thank you so much. And thanks for going on the journey with us on trying to figure out the technology that's going to be work for the majority.
Yeah. Well, thank you. Thank you. Appreciate your patience.
Thank you so much. I think there was one other group that said that they needed to go, Joanne, Joanne, you said you needed to go early.
Yes,
That's right.
thank you. Melody and I have the same meeting.
That's
at
right.
3.
Yeah.
And so I have goal team 5, which is the caregiver goal. And we, same kind of thing. We're meeting, we're talking. It's just so much information to figure out where we're coming from and where we're heading. We were focusing on coming up with some type of a caregiver creed or something that would help caregivers feel like they were part of the healthcare team. But then we had lively discussion about that, of what is a piece of paper really going to do to help them feel like that. And so we changed our Smarty goal to focus it more on that a certain amount of Idahoans will be touched by a trained professional with a resource to help them identify that they're an integral part of the team. And that kind of goes back to when they go to get that diagnosis, or they get it from primary care or whoever, that there's some kind of, if the primary caregiver provider does not have the time, which a lot of them don't, there's a warm handoff to, whether it's a social worker, area agency on aging, or an occupational therapist that's connected to a primary care physician that can have that second meeting to provide even just a resource, that there are these agencies, Alzheimer's Association, whoever, to provide some resources, but to help them get it in their head what just was laid on them by the diagnosis, and kind of wrap around. And then in that process, help them feel like they're part of the team, help them understand that now we're all in this together, is where we kind of decided to go with that first goal. And discussion about how to corral all the resources that are out there, because everybody has their tip sheet, their handbooks, their education, and being able to have, whether it's, a warehouse on a website that has everything there, so we know we're giving out the same information, and that it's people aren't getting confused because I went to this place and they told me this, and I went to another place and they told me that, and we weren't sure that that would even be something that could happen. But the thought is, if we could have in, state of Idaho ADRD webpage that maybe could have a tab for resources that come from Area Agency on Aging, or this, practice that works with memory care in this area, but we all see what it is, and it's coming pretty much the same messaging, I guess is what I'm trying to say. And that's where we get kind of lost in the vortex of how are we going to accomplish that, but we're plugging along. And so planning on having a meeting next month.
Thank you so much, Joanne. Before Joanne and Melody leave, does anyone have any questions for either Goal Team 3 or Goal Team 5?
This is Leslie from Goal Team 1. I don't have questions, but Melody, I can so relate to your feelings on two levels: the technology of the SharePoint, yes, and just feeling like you've gotten going, but there's so much to do that it's kind of it feels like a slow start. So you're not alone.
Right.
Thank goodness.
And remember, we have until 2028 to do this. We can do this. And once we're chugging along, we'll get there. We'll get
Right.
there. Oh, I'm so glad we can take this journey together. All right. Which other goal team would like to go next?
I
Thanks,
can go ahead
Stephen.
and share for Goal Team
Thanks,
1.
Leslie. Yeah.
Okay, so I've got my notes here. I'm going to have to read some of those. So we've got Tasha Howard and Julie Buck, who are on the call today, and then also Laura Sant on our team. And Tasha, well, first of all, what we're working on is awareness and benefits of early detection. So we have chosen to work on strategy A number 8 first, which is to identify 10 partners across Idaho who provide PSA call to action and key messages. So either to identify ones that are already doing that, those kind of PSA brain health messages, or who want to partner with us. So we divided that into 4 areas. One area Tasha Howard has taken on, and that's to talk with health services. And she also has reached out to, all 4 of us on Goal Team 1 work for U of I Extension. And Tasha has connected with our Bandle marketing, and there are going to be public information officers for health districts, and that is going on, will develop into some kind of PSA. So Tasha, I don't know if you want to jump on and embellish on that or not.
I'll put a summary in the chat.
Okay, that would be great. And this will be getting on that SharePoint this week. So she's working with our Bandle Solutions and seeing what we can do with health services rather than clinic by clinic, more in a broader sense. Laura Sant is working with educational institutions, and she has made some progress in connections there, which again, I will enter into the SharePoint. Julie Buck, who's on the call today, is targeting sports-related brain health and prevention and early detection. So she's been focusing on community sports, semi-professional, college, schools. She's got some connections with high schools and even things like Fox News putting out kind of messages. And I think she's working with Tiffany on where that would go, how that would look with our public service announcements as well. So she is connecting with different college sports teams to see what they already have out and what would be potential partnering for them with ADRD as far as public service announcements. I'm focusing more on organizations that work with seniors and then very young children, preschool age children. So I just went to an Alzheimer's Association summit and I have a lot of connections there. So working very closely with the association on brain health education and early awareness. So looking at ways that we can partner and really we already do. ADRD does a lot of partnering already with Alzheimer's Association. They have their alls.org news, which has PSA messages such as medical, social, and emotional benefits of early detection and 10 warning signs of Alzheimer's. And then a connection that I'm really excited about is the Idaho, I have to read this, Idaho Association for Education of Young Children. IAEYC, and I'm doing brain exercises, just trying to remember that acronym. But at a community meeting, I met a local person who is just starting some work with that through our community college here in southeastern Idaho, right in Idaho Falls. So I'll be joining their community meeting next week to see what kind of PA messaging we can get out there for young children. Because as we all know, it's never too early to start with brain health, whether that's healthy lifestyles or the prevention of those TBIs and so forth. So I will be summarizing those points in the SharePoint later this week. But are there any questions for me about awareness and benefits of early detection and PSA?
Leslie, I just want to say thank you. You all have done a great job. I'll just build upon the Department of Education. So I did meet with them, and we're looking at some sort of, we'd be looking at a campaign that they would help us run. They would be helping with resources as well, which is super exciting. And so we're going to be back in conversation around March. I told them I just really need somebody else to help.
Yes.
So once we get another staff on, but yeah, great job on reaching out and getting conversations started. This is great.
Thank you for your help, Tiffany, with our team. We appreciate it.
All right. Thank you so much. Who else would like to go? What's another group that would like to go? And I apologize because when I was talking about the groups and if anyone would like to join membership wise, I did forget to mention that one of our co-leads on group 4 for community education, so Director Judy Taylor from the Commission on Aging, unfortunately, due to capacity, needs to step down from her co-lead position. So there is that opportunity to help co-lead that team with Dr. Sarah Taves. And I want to say thank you very much for Judy for doing the co-leading part. I really think that the two of them have demonstrated, the great ability with co-leading something, because this can feel overwhelming at time for sure. But again, thank you, Judy, for doing that. Judy said she's not running away from us. So, and I told her she can't, she's not allowed. So, but yeah, so if you want to step in as co-leads to any of these groups or any of these groups, please do let me know. Pam and I did get your message.
Yeah, thank you, Tiffany, for that setup for our goal team. And I too am very sorry to have the power of Judy's mind, as well as the connection that she brings throughout the state and nationally, leaving the leadership position on the group. And we will continue to rely on her. She can't run, or she can run, but she can't hide. That's right. That's it. So I think we've been really we've been thinking a lot about the dementia friendly capacity and kind of normalizing, I think, the work around brain health, dementia. I think we're in a little bit of a holding pattern with kind of understanding where funding lies to continue this work, and with Luann Jensen leaving the team, kind of how we want to move forward and do that very strategically. So Judy and other members of our team, I'd be delighted if you wanted to hop in and provide, other details on what we've been up to. But from my perception, I think that's kind of where we are. Is we've had some really good discussions about, being consistent with messaging, which I think I heard from several others too. How do we make sure we have a consistent focus for where we're sending people, the messages we're sending, particularly as we think about rural communities where we know that it may be one person that's doing a lot of things. And so how do we not overtax them with things we might be asking them to do? But again, our work really dovetails, I think, with what Leslie and the Extension Agency has been doing too, with leading those dementia-friendly work outreach efforts. So as Tiffany said, though, we would welcome additional members that would like to join Goal Team 4. So.
Any thoughts, any feedback? Anyone else from Goal Team Form that wanted to chime in per Sarah's invitation? Okay. Right, we've got Goal Team 1, 3, 4, and 5 who have reported.
I can go, Tiffany.
I'm loving what I'm seeing in the chat too from Tasha. The Vandal Solution Marketing, that sounds like a super plan that they've developed, and really dovetails nicely with what I think we're working on doing. So love to learn more about that, Tasha. Thank you.
Jenny, did you want to go ahead?
Yeah, I can go for Goal Team 2. I was going to try and turn my camera on, but that could be an adventure for all of us. So let's see. Do that really quickly. It's always nice to see who's talking at you. Let's see here. Okay, allow access to my camera. Go right ahead. Okay, well, I'm not going to take your time by trying to do this. So what I would like to talk about is Goal Team 2. And while I appreciate that other teams may need a member or two, I am on the tiniest team. So join Goal Team 2. Now, that's all I'll say about that. But what I find interesting in listening to these report outs is there's a huge amount of synergy between what the goal teams are doing. And as I'm listening to the report outs, I'm thinking, oh, I want to know more about that because that helps me with one of my strategies. So it really does get my brain percolating to hear these reports out. In Goal Team 2, really where our focus has been over the past 6 months is the foundational pieces. And what I mean by that is we've heard in the other team report outs about we really have a desire to have consistency in our information that we disseminate to people. We want to be consistent in that. And so one of the things that we focus on right now are really taking a deep dive into all of the different resources and materials that are out there. And as you know, we're never going to see everything. So what we are going to be doing, we're right now drafting a survey that will go to the members of the ADRD Coalition, and we are going to ask you about what resources you use. We'll also provide links in our survey to different resource sites that you can look at and provide feedback after taking a look at some additional materials. We're going to compile that feedback. And then we are also taking the membership of the ADRD and we're doing a little bit of mapping. So we want to see how the folks on the coalition actually work together. How do we group you together? Are there ways that we can look at this problem and make sure that folks that have a similar focus are getting information that feeds that mission, that focus, and folks that are working in a different setting with a different population, making sure again that those resources are tailored more to that individual group's focus, and then making recommendations based on that. So right now the survey is in a draft stage. We will draft it. We will then submit it through Tiffany for IDHW review, and then they'll assist us in administering that. But what I would like to say to the other goal team leads is that I believe what a good practice would be is to send you a copy of the draft survey. Certainly, if there are additional resource related or alliance related questions as far as people's expertise, interest, people that are not represented in the group now that need to be represented. Those are the kind of feedback you could provide, and then we could make sure that not only we do a meaningful survey for our goal team, but perhaps we can also make it meaningful for some of the other goal teams as well. So I will do that. My goal is I work with Pam Eliason, so I'm so lucky about that because she's an amazing partner. We want to have the draft ready in March, and then gather that feedback from you all, and then we would submit it to Tiffany for IDHW approval, and then the administration. So really, really hoping to have survey results available to share with you at our, is it June, our next meeting? Yep. Okay. So then we would hope to be able to share our findings at the June meeting. And that's really basically what we've been up to. So join our team. Thank you.
Jenny, thank you so much. And I don't know if you caught it in the chat or not, but Pam Z just earlier, she asked if she could join your team. So
welcome, Pam. Yes,
we'll reach out to you. She'll be a great resource for you. I think she'll be a good mix with you too. Anyone have any questions for Jenny and Goal Team 2? All right. Okay, so we've done 1, 2, 3, 4, 5. Oh, that makes it easy. So we have Goal Team 6 and Goal Team 7. Do we have anyone on from those two goal teams? I'm not hearing anyone. Okay, so if we don't have goal team updates for goal team 6 or 7, then that means we're actually finished with all of our updates. One thing that, you know, with hearing everybody talk today, and again, please forgive me, I hope that once we get a new staff on, then we'll be able to give better focus, really giving you that time so that we can look at making sure that you all are connecting for those overlapping opportunities. Tasha, I really appreciate that you took the initiative and threw your email out there to Sarah. That really is helpful during this time. And plus, not everything has to go through us. That's the thing. This alliance is really a demonstration of our collaborative efforts. Jenny, you must be really good at your call to help because Yvette just offered to be on your team. Woohoo!
Well, Yvette has to work with me every day, so she's probably
Oh,
making a really smart decision. Thank you,
oh, I see
Yvette.
how
Love
that
you.
works.
Okay.
I see how that works. I didn't even put two and two together. Oh, too funny. All right. Well, let me go ahead and share my slide again with everyone. This is the fun part of the meeting time. As I promised, we're definitely going to get out early today, way ahead of schedule. But this is our time where we really want to open up and allow you to share what activities, events, or opportunities are happening in your community. And to get started on that, I'm just going to go ahead and, sorry, I've got so many different slides up today. Let me go ahead and I'm going to just share a couple of events that were shared with me. What we have right here on the list or the docket is the 12th annual Taking a Stand Against Elder Abuse Conference at Fort Hall. Contact information is up on the screen, of which you'll get the slides for. But if any of these are like tomorrow, you might want to take a picture of the screen because we don't get the slides out right away. The next are the memory cafes. They've been starting to pop up around the community, definitely in the Treasure Valley. And there's a few more that are getting ready to start up. If you want it, maybe you don't have memory cafes in your community, but you want to learn more, Karen would be the contact person for that. The next is the annual Family Caregiver Conference, which is happening on March 9th. There's English as well as Spanish sessions for that, and registration and information can be accessed on the link below. And then the Hispanic American Indian Healthcare Conference, which is happening in July. Registration and information is included on the screen there for you. And if everybody's comfortable, I'm going to go ahead and stop sharing my screen and open it up for all of you to please share any events, education opportunities, anything that you want to share that can benefit our communities that we serve and are a part of. So I'm opening the floor, and please take yourself off of mute.
Tiffany, I'll just provide this is Sarah Taves providing a brief update. We are in the process of applying for a HRSA grant that's specific to geriatric workforce enhancement training, specific to age-friendly health systems and dementia-friendly systems. The focus of this work is specifically on areas that serve tribal members, tribal organizations, underserved populations, and rural. And so we are hoping that we can bring this funding to Idaho and pair it with the work that you are doing. I hear your name mentioned in our conversations with others around this grant, so I know you are making an impact, and all of you in this call are certainly part of that movement to bring brain health, dementia support for individuals with dementia and their caregivers to the forefront. So we're working diligently to get that proposal submitted. And another thing I'd like to mention is I was able to join the biannual twice a year call that Tiffany hosts with members of the tribes in Idaho as an open house. And it was it was a wonderful experience to be able to be in the virtual room with representatives and from the tribal organizations, from these sovereign nations, and hear their concerns, the opportunities that are going on there. Oh my gosh. I mean, Nimpupu they're building a long-term care center. They're going to populate it with staff that are from the community. I just think that is so awesome what they're doing, to hear from Duck Valley. So again, I think this work that you're doing, Tiffany, to complete the table, to bring everyone to the table is really important, and I appreciate it.
Thank you so much. Does anyone else have any events or education or other opportunities? I know there's some legislative days that are happening as well. Does anyone want to share about that?
Yeah. Hello, this is Lynn. Lynn Fines with Idaho Commission on Aging. Hey, Lisa Anderson told me yesterday that the Alzheimer's Day is going to be February 27th at the state capitol. I got a word from the Boise VA Caregiver Summit is April 23rd, 8:30 to 12. The title is Beyond the Caregiving Role, Seeing the Whole Caregiver. I haven't seen a flyer yet, but I mean, if you want to attend, I'll be sure to get that out or post that on a website or whatever. Or if you want to have a table, but it is the VA in Boise that's hosting it. That's really all I have.
Well, we do have our legislative luncheon. This is the Idaho Caregiver Alliance is hosting our annual legislative luncheon on Wednesday, Valentine's Day, the 14th. Please join us if you're available. It will include soup, lunch, cookies, and a chance to visit with legislators and policymakers to talk about your story as a caregiver or as an individual living with a chronic disease, or just there to support the work that the state has done to build out a program for ADRD. I think, this is a huge thank you and it's a success that we can celebrate with our policymakers about the funding that they allocated and the progress that is being made. So we welcome your participation on Wednesday the 14th. Lunch will be from like 11 to 1. Join us and plan to have a conversation with your legislative representatives.
Thank you so much, Lynn, and thank you, Sarah, for that.
Tiffany, I'll put a plug out there for education. If just a friendly reminder that if anybody needs education for caregivers or for staff, the Alzheimer's Association has a full list of curriculum that we can bring to you free of charge. So I can help out with anybody in the 10 northern counties, and I know Mercedes is on here. She can help with anybody in the southern counties. So definitely utilize us as a community resource.
Michelle, thank you so much for that. Michelle and Mercedes, would you mind putting your emails in the chat so then people can reach out to you? And I just really have to say, I am so lucky that we have such a great relationship with both of our representing Alzheimer's associations. You guys have done great work to get out there and reach the communities, especially after the time of COVID, where we've really had to reestablish in some areas. Michelle Larson has been working with us on reaching out to our clinics all up in the North Panhandle, providing educational materials for the primary care providers or the clinicians, as well as information that can be for the individual, the family caregivers, and so on. So thank you so much. And Mercedes did some great outreach last year, and I've got her teed up for a couple other things that I need now. So thank you so much. I know everybody is running with very small staff and capacity. It makes it a lot easier when we can all work together and tackle these things for sure. Thank you. Did anyone else have any other events or anything that they'd like to share? All right. So what I'd like to do is actually share a couple things that Dr. Melchiori had sent me and asked if I would share with everyone. These are a couple education classes that are happening. I'm going to make this a little bit smaller so that you can all see it on your screen. And this one, it looks like it's in person. So this is up in North Idaho. This is one of the nurses from Kootenai Health, and she's offering the Positive Approach to Care workshop. So this is a Teepa Snow educational session that she's offering. Super excited with the work that Dr. Malchiori, Linda, and all the team up in North Idaho. They're really trying to push some great education for family caregivers out there. The next one is they are offering is a powerful tools for caregivers, and this one is up in North Idaho. Again, this one looks like this one's in person. Registration information is there, so I'll make sure to get this out to everyone with the QR code. But if you'd like this information right away, please maybe take a screenshot or a picture with your phone. Like Stephen had said, pictures are good. So that way you can get this information right away and join. I do know that Powerful Tools for Caregivers is also offered through the Janus Aging Strong program. So if you go to janus.org, I think is what it is, you can look up the Powerful Tools for Caregivers that are offered virtually and in person throughout the Treasure Valley area. So there are those two announcements that I had just received yesterday, asking if I would share them because Dr. Malchiori wasn't able to join us. Oh, nice. Thank you, Nancy. So Nancy, did you want to pop off mute to share that?
Oh, yeah, sure. Hi. Yeah, so we have a collection now in our library of materials for ADRD and caregivers, and it's including the entire Teepa Snow training collection. So if you have caregivers or anyone who wants to learn more about her approach, we've got the DVDs you can check out. If you have a library card in Treasure Valley, you can check it out. So there's our library website. It's the catalog that's linked to all the libraries in the area. And we've just added Twin Falls and Mountain Home and Emmett to our consortium courier system. So even those folks can get stuff from the Treasure Valley. So yay.
Nicely done.
Yeah.
Hi, Stephen.
And can I do a plug about Teepa Snow? She is definitely the dementia guru that's out there. I've actually worked with her and I've done some conferences with her in the past. I actually have a call with her later this week, as a matter of fact, but she's the gal that knows it all. I mean, she really relates. Of anybody who doesn't have dementia, she understands it the best.
She is amazing. She's so energetic. I love watching her stuff for sure. It'd be awesome to bring her here. Stephen, maybe we should have some talks. Or she's so expensive. That might be the concern I have.
Well, I put in earlier an organization I'm part of that actually I started. 8 people from across the United States started a group called Dementia Minds. It's the only nonprofit organization started, run, and governed by people living with dementia. So we have different types of dementia: frontal temporal lobe, Alzheimer's, CTE, white matter disease, Lewy body dementia. So there's, we're a great resource, and we get surveys that come through Brenda Roberts. She's our executive director, because people are always wanting to know what does it really mean for this, and they want to get a person with dementia's opinion. So we get surveys that come through our organizations all the time. So if you go to that website and when you contact Brenda, just mention my name. And then if you're trying to get surveys and you're trying to get answers from people, but if you really want to get answers from people living with dementia, you can send it through our organizations. And then depending upon how in-depth the survey are, she'll send it out. There's so many people we have within our organization that she can send it out to get you true responses from, because we have a few phrases: nothing about me without me, nothing about us without us. So we kind of frown upon when people do all this stuff and they've never gotten a person with dementia's opinion, or there's a board about dementia and there's nobody living with dementia on that board.
Right. Stephen, I really appreciate this. This is great. I know Luann had told me about Dementia Minds, and so thank you for bringing that back up.
I'm actually one of the founding members. I'm proud to say that. So yeah.
Nicely done. Good job. I just want to say I really appreciate the fact that you are here and you have a voice and are making your voice heard in this, because something that I remember when we were putting out our caregiver guide, that we're trying to get released here soon, everybody, we still will get there, was the concern or feedback that we received that individuals who have a diagnosis, asking them to advocate is a big ask. And so I don't know where I'm going with that, but I just appreciate you being here.
Yeah, a lot of people just always think of somebody with dementia in late stage. That's always the thought of somebody, in a wheelchair, humped over, drooling. There's a lot of people with early stage or early onset that are still capable. I mean, we have some people in our organization that have moved along where they're in full-time nursing care and they're not able to be with our organization or whatnot, but you're actually getting firsthand information from people living with the disease at different stages at the same time too.
This is wonderful. This is so valuable. And I really appreciate the nothing about us without us. Yeah, thank you. Leslie, I see you have a hand up.
Yes. Our team had a question. When we find an organization who does want to partner, they don't already have a PSA going, but they want to partner with ADRD, what is our next step? Do we just send you their contact information? I mean, other than putting it in the SharePoint, we're not quite sure. Where does it go from there?
Leslie, I think that's a really good question, because I think that, of course, because the ADRD program is responsible to making sure that the strategic plan and the activities are accomplished. So we'd want to be involved and aware. But at the same time, I really see this as an opportunity for diversifying our assets.
Okay.
And so can I tell you that I don't have a right or a perfect answer at this time? And I'd really love to brainstorm with you on that, because if we could tackle this all together, that would be helpful. And I don't want to delay things because I'm a staff of one at this time.
Right.
But I also know that everybody else is busy as well. So could we brainstorm more on that?
Sure. I just wanted to bring that up because that was a question in our team meeting a few days ago. So
right.
Kind of what are next steps? How extensive do we as extension educators carry these actions? So yes, let's get together and brainstorm.
Yeah, and I think, Leslie, the great thing is of